And as one of the first women integrated into ground combat units, I went months without access to a bathroom because, as my commander told me, the ratio was not in my favor. Due to operational constraints that my male counterparts did not face, I developed pelvic floor dysfunction because there was simply nowhere for me to urinate, both in garrison and operationally. 1 in 3 civilian women experience pelvic floor dysfunction, and without data, we don't know how many women veterans do, but we can almost certainly assume that it's a lot higher. This condition has affected nearly every aspect of both my physical and mental health. Yet, it was not determined to be service-connected because there is quite literally no VA diagnostic code for pelvic floor dysfunction, despite its well-established link to reproductive health complications and infertility. I separated the military 2 years ago. I'm still learning the impacts of my burn pit exposure, my daily handling of ordnance, and my overall blast exposures. But what I do know is that I have been diagnosed with pelvic floor dysfunction and the VA won't help me. So now, as I start planning a family with my spouse, I have to explain to them that without my VA service connection, we might have to pay $30,000 or more in out-of-pocket costs for fertility treatment because I didn't have a bathroom while serving my country. This story is not unique. Women veterans experience infertility at rates twice as the rate of civilian women's, and a 2020 internal SWAN study found that it could be as high as 4 times higher, with BIPOC communities disproportionately represented. Yet access to fertility care through the VA remains limited, as mentioned today. The burden of proof that veterans have is extremely difficult, particularly without a clear physical trauma. The first comprehensive study on VA infertility diagnoses was conducted in December 2021 under the Deborah Sampson Act. That fact alone highlights how little we understand about women's health reproductive issues. And that's why today SWAN strongly supports this legislation. Ranking Member Brownlee's Veterans Infertility Treatment Act codifies recent VA policy changes into law, which so importantly ensures the access is not dependent on shifting administrations. Dr. Morrison's Warrior Infertility Act would recognize infertility as a presumptive condition for toxic exposure under the PACT Act, eliminating the high burden of proof currently required to establish service connection, as both me and many other women veterans have experienced. At a time when women veterans are already facing new restrictions on reproductive health care, including December's quiet rollback of abortion counseling and services in the case of rape and/or incest, it is particularly important that the VA ensures the ability to build a family is not blocked by outdated policies, incomplete research, and unnecessary bureaucratic barriers. As one of our community members put it, infertility treatment is too often treated as an elective procedure rather than the disease that it is.